Hello and welcome. So, today we are going to talk about acceptable intakes for mutagenic impurities in relation to LTL exposure. What is meant by LTL exposure? So, LTL exposure stands for less than lifetime exposure. So, for example, you have a drug product which need not to be given for the entire lifetime, but it can be just given for a period of, let us say, 1 month, and that is called as the less than lifetime exposure. So in case if you have a drug product which is given for the less than lifetime exposure, can you get some advantage in setting the acceptable intakes for mutagenic impurities associated with that specific drug product? That is the purpose of today's discussion. So if you go to ICH M7R1, that actually talks about the how one can control the impurities which are DNA reactive or mutagenic in the nature. And then you will find the TTC approach mentioned over there to set the acceptable intake for mutagenic impurities. So according to the TTC approach, the acceptable intake or AI for mutagenic substance is said to be not more than 1.5 micrograms per day. Now, when I say 1.5 micrograms per day, again, this particular limit or acceptable intake or daily acceptable intake is decided by considering 70 years of the lifetime expectancy, and the treatment is going to run for the entire lifetime. That means that if you consume this drug product not for 1 month or 1 year but until 70 years, then 1.5 microgram is the acceptable intake, allowable acceptable intake for the mutagenic substance. But is that the situation every time? Don't you have some drug products which need not to be consumed for the lifetime, maybe for 1 year or maybe for 1 month? So how one can understand the acceptable intake in case if the drug product has to be only consumed for 1 month or a year? And the good news is ICH M7R1 again has given the guidance on understanding the acceptable intake. In case if your drug product is not need to be given for the complete lifetime, but have the less than lifetime exposure. So before we talk about the acceptable intake in case of LTL exposure, let us first understand what is the fundamentals based on which this LTL exposure acceptable intake has been derived. So the the acceptable intake in case of less than lifetime exposure is actually based on to the principles of the Haber's rule. So Haber was the German toxicologist, and he has derived a theory which says that the toxicological effect is always dependent on to the concentration as well as the time, and the product of the concentration and time is always a constant. So this is the fundamental based on to which the Haber's has predicted the toxicological effect with the certain concentration with the certain time. And if you look at again the ICH-M7R1 guideline, you will find that the TTC is 1.5 micrograms per person per day for an expected lifetime of 70 years. So if you calculate over a period of 70 years, how much quantity or concentration of this mutagenic impurity is going to be consumed, and you can find this into this particular diagram. So you will say that okay, for a day, if the patient consume 1.5 micrograms of the mutagenic substance for 70 years, so what is going to be the consumption in a day? I'm so sorry, not in a day. In a day, it will be 1.5 microgram. Now this is over a period of 70 years. And let us understand, the acceptable intake for lifelong treatment, how it can be calculated. So this is the calculation formula again provided into the ICH M7 guideline, and they said that the 1.5 microgram into the number of days available into the 70 years, and it is going to be 25,550 days divided by total number of treatment of the days. So over a period of time, you understand that, let us say the exposure of the drug product is only for a day, not for the 70 years of the time. So to have the similar life expectancy that is possible by consuming 1.5 microgram day, 1.5 microgram of the mutagenic substance over 70 years. The similar life expectancy is possible if the 38,250 microgram of the mutagenic substance consumed only once. Or in case if I say the 1270 microgram of the mutagenic substance is exposed for a period of 1 month, then again the similar kind of expectancy of the life is possible around 70 years. Or if you go further, you will find that the 100 micrograms if consumed for a year, or 10 microgram if consumed for 10 years, or if 1.5 microgram is consumed until the 70 years. 1 in 1 lakh means there can be chance of a tumor in one human being within a or amongst the 1 lakh treated human beings. So the expectancy can be similar if the 38,250 microgram is given once in a life, 1 day, 1270 microgram for the over period of 1 month, 100 microgram over a period of 1 year, 10 microgram over a period of 10 years, and again finally 1.5 microgram over a period of 70 years. One human being can get affected because of the tumor out of 1 lakh treated human beings. 1 in 1 lakh. That is the very conservative approach. But if you look at the less than lifetime exposure, do you think that this is going to be the allowable acceptable intake for 1 day exposure, that is 38,250 microgram? Do you think if your drug product is given for a 1 month duration, the 1270 microgram is going to be the acceptable intake? Certainly not. Because again, there is a safety factor associated during the calculation over a period of less than lifetime exposure. And you can see over here the safety factor of what? 300 to 10x. That means to calculate the acceptable intake with less than 1 month of the drug product exposure, you will not get the 1270 microgram of the acceptable intake, but you will find 120 microgram as the acceptable intake. Similarly, if you say that, okay, for 1 year exposure, I think 100 micrograms should be the allowable acceptable intake for the mutagenic impurities, but you will only find 20 microgram as the allowable acceptable intake for the mutagenic substance or the impurity. And you will find the factor over here like 60 to 5x for until 1 year. So this 5x will actually give the 20 microgram. In the same way, if you look at the acceptable intake for a mutagenic substance for a drug product with the duration of the treatment until 1 month, supposed to be 1270 microgram, but you will find the safety factor of 10x. 10x means what? 1270 divided by 10 gives almost around 127 or roughly 120 microgram. So this way the safety factors would be used, and you cannot just extrapolate the time duration, and accordingly the concentration cannot be defined. So acceptable intake for an individual mutagenic impurity now. And this is a table you can easily understand from which the information has been drawn. So for equal to or less than a 1 month duration of the treatment, the mutagenic impurity can have the daily intake of 120 micrograms per day. Then 1 to 12 month, 20 micrograms per day, 1 to 10 years, 10 micrograms per day, and obviously greater than 10 years until the lifetime means until 70 years, 1.5 micrograms per day intake is allowable. And here is the example for understanding how this limit can be calculated. So let us assume that the duration of the treatment is 15 days. And according to this one table, you can easily understand that the daily intake for mutagenic impurity is going to be 120 micrograms per day. Let us assume that the maximum daily dose of your drug product is 100 mg. So the acceptable limit in terms of ppm can be calculated with the formula of acceptable intake in microgram divided by maximum daily dose in gram. So just put the acceptable intake in microgram, which is 120 micrograms in this case, divided by maximum daily dose in gram, which is the zero point 0.1 gram in this example, and you will find that the 1200 ppm is the limit for your mutagenic impurities. Similarly, you will be also able to calculate the acceptable limit in terms of the percent, and you can see the calculation on the right side of the screen. If a drug is administered once per week for 2 years, so the duration of the treatment looks like a 2 years, but whether the daily exposure is given, no. The administration or the drug is only administered once a week, and for 2 years is the complete treatment duration. So what should be the acceptable intake in case if you have the mutagenic impurity present into this particular drug product? So this is a table I think you must have seen in the earlier slide, the duration treatment and the daily intake. So I'm asking you now, so can acceptable intake be 10 micrograms per day as the duration is between 1 year to 10 years. 2 years is the complete duration time. So I can see that the 20 microgram can be the acceptable intake. But is that the true? So the answer to this question is no. And the reason again, the acceptable daily intake should be based on the total number of dosing days instead of the time interval over which the doses were administered. So what is the actual uh, total number of dosing days? So 1 day per a week, or you can say 4 days per the month. So if you calculate the number of the total number of dosing days for 2 years of the time, how much they will be? There will be 104 dosing days, or approximately 3.5 months. So now you understand that the total number of dosing days is 3.5 months. So which limit you must follow, right? So the dose is in between 1 to 12 months, and hence you must be able to follow the 20 micrograms per day acceptable intake for the given impurity. I hope you understand this. Earlier I asked that, so can acceptable intake be 10 micrograms per day? I was assuming this with the 1 to 10 years of the exposure period. And then I realized that no, it is not the daily exposure, but the exposure only happens once a week. And hence for 2 years, the total number of dosing days will only be 104 dosing days or 3.5 months. And if I calculate the allowable daily intake for for 3.5 months, which falls under this category, greater than a month but less than 12 months. So 20 microgram per day acceptable intake will be allowable. So acceptable intake for an individual class 1 mutagenic impurity. Now whatever I talked about the uh, acceptable intake in the earlier presentation till this time is for the class 2 or class 3 impurities. What is meant by class 2 or class 3 impurities? Now these are the impurities These are the mutagenic impurities for which you do not have the toxicological data. You have only performed AIMS test, which is in vitro study, but no in vivo study is performed. Or based on to the SAR structure alert relationship, you have identified that this looks to be the possible mutagenic, but you have not conducted any kind of toxicological study. So that is called as the class 2 and class 3 mutagenic substances, likely to be mutagenic. You are not sure about it. But the class 1 is what? The class 1 is what? You actually conducted the in vivo study, toxicological study on the rodents, and that has been found to be a mutagenic substance. So that is called as the class 1 mutagenic substance. So now let us understand the acceptable intake for an individual class 1 mutagenic substance. So the acceptable intake for class 1 can be adjusted for a shorter duration of use in the same proportions as defined for class 2, class 3, or not more than 0.5%, whichever is lower. So let me first make you clear on one point, that the class 1 mutagenic impurity will have its own acceptable intake. 1.5 microgram per day is not going to be applicable for the class 1 impurities. Yes or no? Because 1.5 microgram is only applicable in case if you do not perform the toxicological study. So for class 1 drug substances or class 1 mutagenic substances, you will have their own limit, and which is of course greater than 1.5 microgram unless and until they doesn't fall under the cohort of concern category. Now this limit again defined based on to the 70 years of the lifetime exposure. But in case if you have the class 1 mutagenic impurity, and if that drug product is given for the less than lifetime exposure, then you can certainly have the higher than its earlier defined acceptable intake for the 70 years. You can use the similar kind of approach given for the class 2 and class 3. So if you look at the table below now, if over here, you will find that in case if the lifetime exposure is possible, then the acceptable intake for the impurity is 1.5 microgram per day. And in case if the acceptable intake is 1.5 micrograms per day, then if the same drug's product is having the treatment duration of around 1 to 10 years, then the 10 micrograms per day can become the acceptable intake. But in case if I know the limit of the impurity now, which is not 1.5 micrograms per day, but let us assume it is 15 micrograms per day. Let us assume it is 15 micrograms per day because I'm talking about the class 1 mutagenic impurities. And class 1 mutagenic impurities have their own defined acceptable intake. And just for this time, assume that the acceptable intake for class 1 mutagenic impurity is 15 microgram. So I want you to correlate now. For 1.5 microgram, if the daily intake is 10 micrograms for 1 to 10 years, back bracket, what will be the daily intake in case the 15 microgram is the uh, limit for the lifetime? I'm asking to calculate the daily intake for 1 to 10 years now. So 15 micrograms for the lifetime. So 100 micrograms is going to become for the 1 to 10 years. Similarly, the 200 micrograms will become for the 1 to 12 months. Similarly, 1200 microgram will be applicable for the less than 1 month exposure. I would like to bring the similar example for explanation of this particular term. Let us say that an acceptable intake for class 1 impurity is 15 microgram per day for the lifetime exposure. So the less than lifetime limit can be increased as below now. I'm just correlating if 1.5 microgram was the acceptable intake for more than 10 years, that time 10 microgram was the acceptable intake for 1 to 10 years. Now as my lifetime exposure limit is 15 microgram, just 10 times than this, then this 10 is going to become what? 100. But 100 micrograms per day And there is again one more term included, which is zero point 0.5 microgram, whichever is smaller. 100 micrograms per day or 0.5% of the total daily intake, whichever is smaller, for 1 to 10 years of the treatment. In case if it is 1 to 12th month, it is going to become now 200 micrograms per day or 0.5 microgram, 0.5% total daily intake, whichever is smaller. Similarly, I will also be able to understand the allowable daily intake for less than a month, and which is going to be 1200 microgram per day, or but now as it is class 1 mutagenic impurities and as per the guidance provided over here, the 0.5% has also to be compared. Let me explain this with the help of example now. So for a drug product with a maximum daily dose of, for instance, let us say 100 milligram. So 100 milligram is your maximum daily dose of the drug product. So the acceptable daily intake for less than 1 month duration will be how much? Either 1200 microgram as given over here or 0.5% total daily intake, whichever is the smaller or the lower. So I need to understand whether 0.5% is smaller or 1200 microgram is smaller. So I've just calculated the 0.5 microgram, 0.5% of 100 mg, and it is found to be 500 microgram. So which one is smaller now? Is 1200 microgram smaller or 500 microgram is smaller? Absolutely 500 microgram is smaller. So what is going to be the limit now? So the limit according to less than lifetime approach is going to be a 0.5% for this particular impurity. I hope you understand. Then in case if you have the multiple mutagenic impurities into your drug product, so far we only talked about the understanding the acceptable intake in case if there is only single impurity present into the drug product. But in case if there are multiple mutagenic impurities, maybe 2 or 3 or more than 3, how one can define the limits? The first point, the TTC based acceptable intakes should be applied to each individual impurity. That means you have to only consider the TTC based acceptable intake. For example, in case of class 2 and class 3, 1.5 microgram per day is going to be the acceptable intake. Or in case of the class 1, then you can understand the structure specific acceptable intake. So that is going to be the limit. But when there are two class 2 or class 3 impurities, in case if you have two different either class 2 or two different class 3 or maybe one class 2 and second impurity is class 3 impurities, in that case also you can still apply the individual limits, means the individual TTC limits can still be applied. Now when there are 3 or more class 2 or class 3 impurities, maybe only 3 class 2 impurities or maybe only 3 class 3 impurities or maybe 2 class 2 impurities and 1 class 3 impurities, but altogether you have 3 or more than 3 mutagenic impurities, then the limit as described in the below table needs to be followed. In that case, you need not to have the individual limit for all these 3 impurities, but rather than that, you can have the total daily intake or total limit for these 3 mutagenic impurities. And you can see what is the limit mentioned for a month, for a 12 month, for 10 years, and for the more than 10 years of the lifetime or until the lifetime. So let us understand with the help of example now. So here is the example onto your screen. A product with a maximum daily dose of 100 mg has a duration treatment of 15 days and has two different class 2 impurities, let us say impurity A and impurity B. And there is one more impurity which is a class 3 impurity, which is impurity C. Define the individual and total impurity limits based on to the LTL exposure. So individual impurity limit is not necessary in this case. Why? Because there are three or more than three impurities. Yes or no? More than three mutagenic impurities. So rather than individual impurity limit, you can go for the total mutagenic impurity limit. So total intake for impurity A, impurity B and impurity C can be 120 micrograms per day because it is less than a month exposure of the treatment. I hope you understand this point. Okay, so far we talked about how one can define the acceptable intake for multiple mutagenic impurities into a given drug substance as a single drug substance. But in case if you have a drug product which is a combination of the more than one drug substances, and if you have the multiple mutagenic impurities, how you are going to define the acceptable intake? So this is the point where we are going to talk about how to define the acceptable intakes for multiple mutagenic impurities for the combination drug product. So for combination drug product, each active ingredient should be regulated separately. Means in case if you have the, let us say, two different drug substances present into a drug product, DS1 and DS2. So if DS1 has three or more class 2 or class 3 mutagenic impurities, their total daily intake will be as per the below table. And I explained the part on how to define the limit. So this is again separately for drug substance 1, and in the similar way you can also able to define the total intake for the all mutagenic impurities present into the drug substance 2 as per the similar table. Finally, only specified class 2 and class 3 impurities are included in the calculation of the total limit. So please don't get confused in case if you have the another impurities present into a drug product. Is the limit including that impurities also? No, that is excluding. So in case of only mutagenic impurities, this total impurity limit is applicable. Even the class 1 impurities should not be included in the total limit of class 2 and class 3 impurities. So whatever total limits we talked in the presentation is only including class 2 and class 3 impurities. The class 1 impurities excluded out of this total impurity limit. And finally, degradation products will be controlled individually and a total limit would not be applied and should not be included in the total limits for class 2 and class 3 impurities. So whatever your Q3A, Q3B approaches, according to that, you can have the individual limit for non-mutagenic impurities and you should not include that impurities into the class 2 and class 3 total impurity limit. Thank you so much.